One of the biggest drawbacks to facilitation of our patient compliance is clients who don't really understand what we're doing when we're doing dentistry procedures. And I think we're probably, as general practitioners, and I include myself in that pool, and did so for many years, I think we didn't educate clients as well as we could have just because we weren't educated in the educational process. We, again, relied on maybe a lot of the representatives for the products and their posters that showed stages of periodontal disease. We succumbed to the media every year for National Pet Dental Health Month that caused us to try to market that for 1 month out of the year so that we had as many patients as we could possibly get in 1 month and do as many patients per day in that month and meet revenue goals. And all of that is totally counterintuitive and totally against the standard of care in veterinary dentistry today, where, again, we're doing surgical extractions, we're taking full mouth radiographs, and we're treating every patient to the full extent to remove all disease using surgical extractions, cleaning and closure, and not putting emphasis at all or very little emphasis on cleaning the crown, which is not what we should be doing. We should be looking at what's under the gum and not the crown, as opposed to what we've been taught all these years and the media has gotten us to believe so that they can sell their products. So very simply, we use a series of images which show all of the changes that you can expect to see in almost every periodontal case, so that the client has a clear understanding of what they can expect when the patient's under anesthesia and what we'll be doing with the patient once we're there. So we have 4 slides that we utilize, and these 4 slides are in the image library that all of you should have when you registered for this course. And so you can use these 4 slides, and you can use them in the manner that I'm about to describe as I talk to you based on the contention that you're a client and I'm the doctor describing these 4 slides. So you can use these in that manner, talk to clients directly, describe what we're about to see, so that they fully understand, not only from a verbal standpoint, but also from a visual standpoint. So I'm going to walk you through as if this were our client and I was talking to the client in the exam room. So Mrs. Jones, this is a depiction of a patient that we saw in my general practice years ago. And as you can see, there's no calculus, there's no inflammation of the tissue here. Counter to what we see with Fluffy, who has a lot of calculus, or tartar as it's called, and she has gum recession, where the gum is pulled away from the tooth and pulled back down from the crown. She also has a lot of inflammation around the gum at the line between the tooth and the gum. So this patient doesn't have any of that, but what I'm going to show you is an x-ray of this area so that you can see how profound this can be in a patient that doesn't even have any outward signs like Fluffy has. So look at this area here, and you can see that there's a black void where this normal white bone consistency is gone. And this is due to periodontal disease, which starts with plaque, and that plaque has a lot of bad bacteria in it